everyone, Lori McKenzie, Christian mental health therapist. I just attempted to do a video at Dollar Tree on some mental health tips based on items there, but it was too busy and too messy. So I thought instead I would do another segment of what is counseling, specifically Christian counseling. And I started with what counseling isn't. And my first couple of videos talked about how it isn't a replacement for Christian discipleship. It isn't a replacement for Christian fellowship. And now I'd like just to mention that it isn't a replacement for the regular, ordinary supports we should have in our life. I can't tell you how many times I had a Christian come to me for counseling. They'd never been to counseling before. They're maybe in the middle age. And one of the first questions I ask is, why now? Because that's significant. And oftentimes there is some legitimate mental health, mental illness oriented issues, or significant recent trauma or something like that. But oftentimes it's somebody who needs support that isn't getting it. And so what they're looking for is someone that can sit with them in their pain, not give them, scriptures. It could be worse. Other people have it worse. All that kind of stuff. That's not what they need. So another video I'll do at some point is how to support people without kind of doing that, without trying to solve it for them or give them scriptures to kind of make it all go away. Anyhow, so some of these folks are just looking for support. Maybe they don't have a lot of family support. Maybe they're not accessing it well. So that's something we can explore. I'll see someone like that for a few sessions just to help them figure out what's going on. Maybe they need a support group. But therapy isn't support, because then that can develop kind of an unhealthy dependency. Really, the role of a therapist in that case is to assess if there's anything else going on that would be appropriate for counseling, see what the obstacles might be to that person having some healthier support in their life, and help them access some. So, like I said, I'll meet with someone a few times, try to assess all of that, and point them to pursuing maybe a small group at church, or, is there something getting in the way of them accessing the support from people naturally? But yeah, therapy is not just a place to get support. We give support, but you need to be having some of that in your life, and it's not really appropriate to be seeing a therapist for that, especially on any kind of ongoing basis. Okay, until next time, bye-bye.